report says we could see lingering effects from the coronavirus pandemic long after it's gone.
Yeah, this study looked at previous disasters and their impact on mental health. Local 12's Christian Hauser shows us why it's so important for you to protect yourself both mentally and physically.
COVID-19 and its forced lockdowns and social distancing have put our economy into an extreme downturn. But those could just be the first of many more negative impacts that we see from the pandemic.
You might not think a wildfire has much to do with the COVID-19 pandemic, but researchers say they're actually quite similar in how they put us into a crisis mode. The 2016 Fort McMurray wildfire forced many people out of their home for more than a month, and many of them lost their jobs. After the wildfire, researchers say visits to mental health professionals and prescriptions for antidepressants shot up in the months after.
For COVID-19, it could create an increase of up to threefold in mental health practitioner visits and 20% more prescriptions of antidepressants.
Researchers also looked at the recessions of 2008 and 1990 and how the job losses affected people. They found higher rates of mental illness, worse educational outcomes, and an increase in substance abuse and crime. Healthcare workers like Jen Dorshug say they are noticing an increase in people needing mental health services.
I think what we've seen here since COVID has happened is much more exacerbation of symptoms. People are, if they were depressed before, this is definitely adding to it.
Dorshug worries there's probably not going to be enough mental health workers to handle the increased demand.
That's probably around the corner as well. I know agencies have dealt with kind of financial shortages and that sort of thing and had to make some staffing changes in that.
Deloitte predicts visits to mental health professionals will nearly triple, and it says women will be especially hard hit since 3 times as many women have lost their jobs so far. In Cincinnati, Christian Hauser, Local 12 News.
Christian, thank you. Some good news here. That report says there is still time for you to prepare. It says government should do what they can to increase mental health services and make it easier for people to access that support. Where you work can also help. The study recommends that employers offer extra health benefits and allow for more flexible schedules when they can.